The purpose of this DVD or video, wherever you're watching it, is to educate and inform you why you're sick, what is actually happening in your body that is causing you to feel the way you're feeling, and what you need to do to fix it. If you are diagnosed with a chronic condition, you should listen carefully to this. If you're diagnosed with thyroid condition, suffer from low energy, given medication to take for the rest of your life, you should listen carefully to what I'm about to say. If you're diagnosed with fibromyalgia from weight gain and do not want to take medication for the rest of your life, you should stop this video, take a pen and piece of paper, and start taking notes. You're about to hear some groundbreaking, transformational knowledge that has affected many lives. It has helped hundreds of patients successfully. There is a reason that patients travel from other parts of the United States to our office. They drive hours to get to our office.
Hi, my name is Adrian James from Baltimore, Maryland. I've been going from doctor to doctor for 8 months long, and nobody can find what's going on. And Dr. Maz just found out in just 30 minutes of just seeing him, and I'm getting better and better every day, and I'm just so grateful. I thank God for everything, and I thank Dr. Maz and everybody here at MedWell.
My name is Dr. Maz. I practice at MedWell LLC, the Center for Chronic Solutions, located in Midland Park. We are a panel of physicians and doctors and therapists working together under one roof. I'm also the author of this book, which you're going to see on the screen, How to Live Pain-Free and Happy, Drug-Free, Non-invasive, non-chemical, non-surgical steps for relieving chronic pain, chronic diabetes, thyroid problem, chronic unrelenting fatigue, fibromyalgia. I've also lectured nationally and internationally about knee arthritis recovery, chronic neck or back pain. Why do I feel like this? Which is the purpose of this video. If you're suffering from insomnia, why you feel that you cannot sleep. What is the actual true cause of it? We're going to go over a lot of information. Neuropathy, restless legs, oxygen therapy. These are not DVDs. This is my life's work, the last 10 years of research. I put a lot of time and effort into these. They used to be available on Amazon for sale. Not anymore. I'm giving it to you for free. You can go to my website at www.drmaz.com, drmaz.com. I'm not here for recognition. I'm not here for applause. I've had enough of that. I'm here to change your life, and when it comes to changing your life, I'm very serious about this. So get a pen and piece of paper ready. Imagine being able to be pain-free without numbness tingling to your arms or to your legs. Imagine being able to sleep well, having the energy to go throughout the day, being able to enjoy life to the fullest with your family and children and friends. Not being labeled that you have this condition or that condition. Hashimoto's thyroiditis, fibromyalgia, chronic fatigue. Having to take pills for the rest of your life. If you have sleeping problem, the solution is not Tylenol PM or Ambien or any other things that you get from local supermarkets. We need to find the cause. If you're always tired and fatigued, the solution is definitely not Red Bull or any other energy drink. That will mess up your adrenal glands. We need to find what is the cause. The cause usually involves multiple systems and organs of the body. And we need to address them at the same time individually. It usually involves gut function, liver function, brain function, thyroid function, adrenal gland function. You need a package of treatment to target all of these. This is why your current treatment is not working, because you are not addressing all of these, and if you are, you're not addressing it at the same time. You have to get everything working together at the same time so you can maximize healing. I wish it was that easy. A plus B would equal C. There is no one remedy for chronic autoimmune conditions, which is what you're suffering with, and we're going to talk about it later. You have to have everything working together optimally. Your brain function, your liver function, your gallbladder function, your thyroid function, your adrenal function, they have to work all together because they need each other for your body to work properly. I tell you, I'm not a professional speaker, but I'm a doctor that you could depend on.
He's very thorough. He's a great person. He's very passionate in what he does. And I'm so glad that I did his program. I just want to say thank you, Dr. Maz.
What causes your autoimmune condition is massive inflammation, toxicity, and decreased immune response. What is common among chronic conditions? Massive inflammation, toxicity, decreased immune response. Why you're having a problem? You have a problem because you have a massive inflammation, your body is toxic, and your immune system cannot handle it. You have decreased immune response. The problem is that most doctors that you have been to, they're organ-based and they deal with one organ. They're highly specialized in one organ. Thyroid doctor looks from here to here. Diabetes doctor looks at your pancreas. Skin doctor looks at your skin. They look at your symptoms and run some tests. As a result of the results of the test, you're labeled that you have this or that condition. I want to eliminate the fact that you're going from doctor to doctor to doctor. I want to reinvent your life. The cause of you having low energy, sleep difficulty, feeling depressed, feeling fatigued, memory loss, GI issues is not even addressed because they look at the organ. They're missing the boat. Because your doctor is looking at your symptoms and not you. We need to treat you as one package, as one person. If your name is Mary, your condition's name will be Mary's condition. It's different from everybody else's condition. Most people who suffer from chronic conditions, they're suffering from an autoimmune condition. What is autoimmune condition? Autoimmune condition is a condition that, due to parasite, viruses, mold, yeast, inflammation, toxicity, on and on and on, they attack your body. Your immune system wants to handle it. It cannot. It attacks other organs and systems of the body. Your thyroid, your pancreas, your liver, your skin, you get allergies, your sleep, your brain most of the time. Then your brain cannot handle it, your organs cannot handle it. Then when your organs cannot handle it, your immune system loses. And then you get autoimmune condition. When you don't eat for energy, your organs do not get proper nutrients to function properly. As a result, they become weak. Make sense? When you don't eat for energy, your organs become weak. Now, when the organs become weak, your immune system's job is to protect them. But your immune system becomes weak too. As a result, your immune system starts attacking your organs. Attacking liver, stomach, because they cannot protect you. Autoimmune conditions, they affect your thyroid function, they affect your liver function, sex drive, brain function, gut function, muscles, joints. Then it remained untreated, your problem becomes chronic. Then you go on to specialist who only looks at your organ and gives you pills. For how long? Rest of your life. Then you get more sick. I want you to understand, chronic conditions require to treat the body, not a system of the body, not an organ of the body, not only definitely a symptom of the body. If you cannot sleep, it could be related to many organs. It could be related to many systems of the body, but it has a cause. We need to treat the cause. Your thyroid will not have optimal function without your liver functioning properly, and your liver will not function properly if your thyroid is not functioning properly, and I'm going to explain to you why in a bit. The main reason your thyroid and pancreas, they're not working, in most cases, it's not even related to thyroid or pancreas. Most of my patients who have thyroid or liver or gut problem or brain fog, it's not even related to these organs. So the pills and the medications that you have been taking has not even addressed the cause, obviously. That's why you're watching this video. You have to look at everything and everything at once. That's what your doctor should do. We need to treat you and not only your symptoms. That is why you're still a mess. That is why you don't get better. That's why you're taking medications. That's why you're even taking supplements and you're not even getting better.
Good morning. My name is Sheriff Michael Sordino, Bergen County Sheriff, and I'm here this morning to thank Dr. Maz and the whole MedWell staff for all they do.
Folks, I want to reinvent your life because there is a lot of confusion, even with supplements. Just because it's natural, it doesn't mean it's good. There is a lot of bad, crappy supplements that actually even make you more sick. Many of you go to local supermarkets and get supplements, thinking you're doing something good for the body. But in reality, you're not. And this is why I recommend you to take actually the supplements I give you, our doctors give you. Because the supplements that our doctors give you, they are live source organic vitamins. The vitamin D that many of you have been taking, it's solvent extracted from sheep's wool. It is solvent extracted from sheep's wool. It is synthetic. And if it's synthetic, it's not going to work and it causes actually more harm to your body. CoQ10. CoQ10 is a known supplement for energy. It is true. I recommend it too. But a lot of you are taking CoQ10s that are synthetic and they're oxidized. Oxidized is no good. Antioxidant is good. Anything that is oxidized is not good. That's why that's the difference between a cheap CoQ10 and a pharmaceutical grade CoQ10. Cheap vitamin B, pharmaceutical grade vitamin B. A lot of you are taking vitamin B and B complex, which again, we recommend it too. But vitamin B, a lot of them, I've seen a lot of patients, I've seen thousands of patients already in my office. A lot of them used to bring vitamin B that's derived from coal tar, petroleum driven, gasoline driven. You don't need to put that in your body. Well, that's why you're a mess to begin with. You have a lot of problems. Vitamin C, the cheapest vitamin C, which I don't even think it is vitamin C, it's ascorbic acid. Ascorbic acid is not vitamin C. It is in a lot of foods. It causes free radicals. Free radicals are not good. Free radicals is why you're a mess today. It's pro-oxidant. Ascorbic acid is pro-oxidant, and you need antioxidant. A lot of cancer patients, they take CoQ10, they take ascorbic acid. It's not good for them. Well, CoQ10 is good, but not the synthetic one. Vitamin C is good, not the ascorbic acid. You are taking synthetic vitamins which are not good for you. You see, synthetic neutral supplements, they actually cause free radicals. They cause something that we call excitotoxins. These are full of chemicals and some of these chemicals, it's called xenoestrogens. Xenoestrogens, they compete with estrogen receptors in your cells and cause a lot of hormonal problems. Ladies, sounds familiar? Hormonal problems. It's because of the diet, because of the supplements that you may be taking. Guess what free radicals and excitotoxins cause? They cause inflammation, toxicity, decreased immune response, which is the problem you're having. You need to stop taking anything that says enriched. Enriched sounds good, but it's horrible. That means they take rock form of iron, rock iron, and add it to white flour, pasta, bagels, pancakes, waffles. And guess what that rock iron do? The rock iron, when it goes in your body, it clogs your liver. Your liver function is vital, right? It's for toxicity. One of the things that your liver converts, it converts T4 to T3 hormones that your thyroid gland requires. So your thyroid has the T4, it has to convert to T3 in your liver. If you have rock form of iron by having enriched foods, this does not take place. So it affects your metabolism, it affects your feelings, it affects your energy. Fibromyalgia patients and thyroid patients, 98% of the thyroid patients that I have, they have fibromyalgia as well. 95% of the fibromyalgia patients, they have a thyroid problem. And nobody looks at their liver. If your liver is shot, the conversion of T4 to T3, it's not going to happen. Does not take place. So you take thyroid pills that your doctor gave you that focuses on your thyroid. You take it for how long? For the rest of your life. And that's why we need to treat the whole body if you want to stop taking the medications that you're taking. If you're suffering from insomnia, I assure you, if you're suffering from sleep problem, I assure you that your adrenal glands are shot. Adrenal glands are on top of your kidneys. And what they do, they produce adrenaline. Adrenaline holds, one of its job is to hold a magnesium in your blood. When your adrenal glands do not function and it's under stress, they also call it a stress gland, magnesium does not stay in your blood. And that is why you're in pain, because magnesium is important for your muscles and bones and joints. If you don't have magnesium, that's why your body goes in pain. That's why when we give you the supplements, the amino acids, the magnesium supplements, you start feeling better. You see, many chronic conditions, especially thyroid, diabetes, fibromyalgia patients, they have thyroid problem. At least 50% of them know about it. 50% of these patients who suffer from a thyroid problem, they don't even know about it because they go to their doctor just does basic tests, TSH, they don't even do T3 and T4. Some doctors do TSH, T3 and T4, they don't do thyroid antibodies. Because thyroid antibodies, they are required on a different organ of the body. Not to mention, the blood ranges, they're made for sick people. That's another video. I'm going to touch on it a little bit. The blood ranges that we have, the normal versus abnormal, they're made for sick people, not healthy people. So what happens, we are looking at functional ranges, which are a lot more narrower than the blood broad ranges that's given. Another thing that is a big misnomer is iodine. See, low thyroid 90% of the time is caused by autoimmune thyroiditis. A lot of people don't take iodine because it is the worst thing to take. Well, a lot of doctors say do not take iodine to their patients as well. And they are partially correct. You should not take processed synthetic iodine. That's very bad for you. But you should take natural, unprocessed iodine that is raw and it's derived from natural source. It will actually help you. It has helped me. Pink salt is a very good source that is unprocessed, raw, natural iodine.
I'm feeling much better. My depression is much less, and I'm hoping to continue the treatment. And the staff at MedWell has been wonderful to me. They've been very kind and understanding and treating me very well, and I'm looking forward to continuing my treatment.
There is cause, problem, symptom. Symptom is a sleeping problem. Symptom is hair loss, low energy. Problem is what is involved to make these symptoms. It's usually an organ, thyroid, brain function, gut function, on and on and on. Cause usually involves multiple systems and organs of the body. We need to treat the cause. For your thyroid gland to work properly, as I said before, you need to have a properly working and operating liver. For an example, 60% of T4 that needs to be converted to T3, it happens in your liver. 20% of T4 that has to be converted to T3, it's in your gut. The thyroid doctor does not care about the GI, gastroenterologist job. The gastroenterologist job doesn't care about your thyroid. And the shrink that you need to see later on, because you don't know what's causing the problem, doesn't care about either of them. You're suffering from an autoimmune condition, and most of my patients, when they suffer from autoimmune condition, they are misdiagnosed. Autoimmune condition, I want you to understand, it trumps all other conditions. There is no pill for autoimmune condition. We need to fix the body at the same time and address all organs at the same time to start seeing results. Doctors, they're good. I have a lot of respect for a lot of doctors. They're good, but mostly they're good for acute conditions. Heart attack, liver transplant, fracture. But when it comes to chronic conditions, they drop the ball. They don't know what to do. They just give pills after pills after pills to manage only the symptoms. For example, thyroid problem or fibromyalgia, it affects every cell in your body. Literally. When you have a thyroid problem or when you have fibromyalgia or chronic fatigue, it affects every cell in your body. When you have diabetes, it affects every cell in your body. When you have a chronic condition, no matter what is it, if it's a chronic autoimmune condition, it affects every single cell in your body. I want to have maximum effect and impact on as many people as I can. Most of my patients, they have been to multiple doctors. They have had multiple tests, and they're still a mess. We are here to help people who have nowhere else to go, who are literally hopeless because they've been to so many doctors. And we try to fix them. Have we been successful? Yes, very successful. But this video is not about me. This video is about you guys. Folks, you're not going to lose weight to become healthy. This is another thing I get. A lot of people, they say, Dr. Maz, I want to lose weight to get healthy. But it's really the other way around. First you get healthy, then you will lose the weight automatically. First you fix the body, how it's supposed to operate, then you will lose the weight. The reason diets don't work, it is because your body is not healthy. The number one reason diets don't work is because your body is not healthy. It cannot lose the weight. It wants to keep the toxins and inflammation. There is reasons behind that. Do you want anti-aging? Anti-aging comes from inside out. It does not come from outside in. We can fix the look, but we cannot fix the operation in the body. With plastic surgery, you cannot fix the operations of the body. If you want true anti-aging, it comes from inside out. We need to fix your inside, and your outside will look better automatically. In order for you to see a doctor who understands what is going on, you need to see a doctor who understands functional neurology and how the brain works. You need to see a doctor who understands functional endocrinology and knows how the hormones work. You need to go to see a doctor who understands how to read the tests, before that actually, what tests to order, how to interpret the test results based on functional ranges, not based on what the lab says. What supplements, medications, and other agents you would need to fix you up. How to monitor your progress. If you are not improving as expected, what is the cause of that? The doctor needs to know that. I'm not telling you to come to us. I'm telling you to go to a doctor who understands this whole concept, which are not that many of them. I assure you there are not that many of them. Why I say there is not that many doctors who understand this whole concept is because many doctors simply, one of the classic misnomers, many doctors, they order blood tests, which unfortunately blood test has a lot of false positives, has a lot of false negatives. As I said, blood tests are made for really, really sick people. As a result, the patient will have unanswered reason for their condition. When many patients, they have unanswered reason for their conditions, they go from doctor to doctor. This doctor gives them pills, this doctor gives them more pills. Then they go to a psychiatrist as a recommendation solely because the doctor cannot find a cause. And when you see a psychiatrist, guess what happens? You get more pills, you get Xanax, you get clonazepam, Valium. You are here because you don't want to take medication for the rest of your life. If these medications were working, you would have been fixed by now or fixed a few years ago. I want you to understand, I'm not curing your condition. I'm not curing your thyroid. I'm not curing your fibromyalgia. I'm not curing your chronic fatigue. I'm not adding or eliminating your medications that you're taking. I'm not adding to your Synthroid. I'm not eliminating Lyrica. I'm not doing any of that with your medication. That's the job of the doctor who prescribed it for you. But I'm here to educate you that Topamax, Neurontin, Lyrica, they're anti-seizure medication. You heard me correctly. They are anti-seizure medication. There are a lot of fibromyalgia patients, they take Lyrica. Why? Because Lyrica, when it came out as an anti-seizure epileptic medication, the patients who had epilepsy, they were taking it and they had pain relief. So the pharmaceutical companies said, well, let's use it for pain relief. But again, I'm not telling you to take it. I'm not telling you not to take it. That's the job of the prescribing physician. I'm just educating you. If you don't believe me, Google it. I'm here for educating you. I don't want to be abrasive. I don't want to be rude. Please don't get me wrong. Most people, they like to be nice than effective. I want to be effective. I want to change your life. I want to be the one that changes your life, and I'm very serious about fixing your body.
After a few weeks and on a regimen that he put me on, I feel a lot better. I'm happy. I don't drink coffee to keep awake. I'm consistently up during the day, and I sleep very good at night.
Most chronic conditions have something in common, as I mentioned before. Most chronic conditions have the underlying cause, which is causing massive inflammation in your body, increased toxicity in your body, and decreased immune response. In order to fix your body and achieve maximum healing, we need to decrease the inflammation, decrease the toxicity, and increase immune response. How we're going to go ahead and do that is we need to diagnose and treat you metabolically, neurologically, and structurally in order to achieve maximum healing. You need to be diagnosed metabolically, you need to be diagnosed neurologically. If you have body pain, you need to be diagnosed structurally. We need to see metabolically if you have lactose or fructose intolerance. We need to see if you have inflammation or bad bacteria in your gut, which I am positive you do, because that's the first area we check, and that's the first area that we find problems. I promise you that you have inflammation in your body that is contributing to your weight gain, depression and anxiety, sleepless nights, low energy, and chronic problems that you're suffering with. That includes autoimmune thyroiditis. We need to see if you have signs of gut problem. Common signs that everybody knows, which we are not looking for, is indigestions, belching, feel bloated after a meal. So if you have these, you definitely have a problem. But if you don't have indigestion, belching, feeling bloated after a meal, that doesn't mean your gut functions properly. This is one of the things I want you to learn and understand. Symptoms is one of the last things that appear. If you have insomnia, lack of sleep, weakness, chronic pain, chronic tiredness, not responding to existing treatment, not responding to medications, getting sick all the time, being depressed all the time, your gut is contributing to it. And you need to be diagnosed properly if it does, and to what degree. If you have a gut problem, if your gut is not functioning properly, the pills and supplements that you're taking now, they're not even getting absorbed. They're not even getting digested. Inflammation is the reason that you're not responding to diet and supplements and many medications that you're even taking. That's why we need to do this painless, non-invasive test, which we do in our office to see if you have inflammation, how much, if you have unwanted bacteria, if you have lactose or fructose intolerance. The next thing that we test is a neurological testing. It's a neurosystemic autonomic nervous system testing to see how the organs function. This is also painless, non-invasive, and it's done over here. The other test that's extremely important is brain mapping test. This is also non-invasive, painless, with zero side effect. Because as soon as I say brain, people panic. It has zero side effect, it is painless, it is non-invasive, and it doesn't do anything to your brain. It only takes information from your brain to see how different parts of the brain they communicate to each other, how they control the body. We need to make sure we normalize your brain activity. So all the organs, they function neurologically in an optimal zone. Because when the organs, they don't function in optimal zone, it could be a neurological phenomena, the brain is not controlling them properly. It could be a vascular problem, there is not enough supply. It could be a hormonal problem where the vascular supply is good, but the diet is crappy. You follow what I'm saying? So this is also a non-invasive, painless, zero side effect diagnostic tool, and as a result, we do treatment, which we're going to touch on a little bit later. If your brain does not function in optimal zone, you'll have functional symptoms. Most people, they want me to explain that. Functional symptoms, they don't show on MRI or X-rays. That's a waste of time. Yeah, if you're looking for a tumor, it's good. But functional symptoms, that contributes to brain not functioning in optimal zone is memory loss, feeling depressed, anxiety, fatigued, messing up your children's name, inability to do simple math, going to work, you don't know how you got there, not responding to medications, not responding to supplements. Sounds familiar?
I'm much more energized, I'm more focused, I sleep better. I can actually work out in the gym now. My knees are feeling better, my back is better, and I hopefully if I can, when I continue coming here, I'll get even more stronger than before.
So when these symptoms that I mentioned happen, that usually indicates there is parts of the brain which controls your organs, like your thyroid, pancreas, gut function, adrenals. They can become underactive. That means they don't have proper amount of activity. And we need to increase their activity. Other parts of the brain, they may be overactive. When you have overactive parts of the brain, then it makes you not to be able to sleep. And we need to lower their activity. How do we do that? We do it with smart brain therapy. Smart brain therapy is a therapy, again, that is painless, non-invasive, with zero side effects that we do in this office. And what it does, it normalizes your brain activity. So as a result, you have more focus. As a result, a lot of these functional symptoms will get better. And the best part about this therapy is it does it involuntarily. So involuntarily, you're going to be watching a movie, involuntarily it normalizes your brain activity while you're watching the movie. Like I said before, it is painless, non-invasive, and with zero side effects. And the results in many patients are permanent. We use it a lot with attention deficit disorders for children, but mainly we use it right now with adult attention deficit. I say an example, it's similar to when you were as a kid, you learned how to ride a bike. You haven't ride a bike for, 20 years, 30 years, 40 years. Now when you start riding it again, it comes back to you naturally because it is planted in your brain how to balance yourself on the bike. And sometimes when you even want to fall, when you're on the bike, you can't because the body doesn't allow you to fall. So if your brain does not function in optimal zone, no matter how much medication you take, no matter how much supplements you take that are good for you, you're not going to get better. Because your brain controls all your body organs. Your brain controls your thyroid. Your brain controls your liver. Your brain controls your pancreas, your stomach, your adrenal glands. Followed by smart brain therapy, many patients are prescribed oxygen treatment. Oxygen treatment is necessary and vital for brain function and many other organs in the body. Let's touch on that a little bit. As you get older, after the age of actually 25, your ability to utilize oxygen that you breathe in, it diminishes about 1% a year. So when you're 50 years old, your ability to utilize oxygen has diminished about 25%. That is considering if you're not smoking. If you're a smoker, it's more than that. Now, your brain needs two things to survive: glucose and oxygen. Glucose, you get it from what you eat. But the oxygen, it comes from breathing. And if there is not enough oxygen neurologically in your body, you're going to be oxygen deprived. Now, neurologically, you need more oxygen in your body than for your cardiovascular system. Most physicians test you based on your cardiovascular system. Okay? So, neurologically, you need a lot more oxygen. Now, when we give oxygen therapy to the brain by just putting oxygen therapy machine next to you while you're in the office, as a result of that, your brain gets the proper energy for the neurons and neurotransmitters to function properly. And oxygen will help you with sleep. Talking about sleep, the reason that you're not sleeping could be your adrenal glands, but we're going to address that later. But oxygen, it's vital for brain function and organ function. That's why most of our patients are prescribed oxygen treatment. Let's talk about sleep. Now, when you have a sleep problem, adrenal glands, which I said they're stress glands, they're in charge of cortisol production. High cortisol is not good. Low cortisol is not good. High cholesterol is not good. Low cholesterol is worse. If you have low cholesterol, you're going to have big problems. Okay? So what we need to do as far as your sleep patterns to fix your sleep, cortisol levels should be stabilized throughout the day. No matter how much you exercise, no matter how little you eat, if your cortisol level is not proper at different times of the day and night, you're not going to be able to sleep. You're not going to be able to lose weight. Very common reason that people, they eat as little as possible and they exercise, they still don't lose the weight because cortisol is not properly managed in their body. The reason I say all of these is because most of our patients, they need a specific, individualized, customized type of program for them. Everybody's condition is different. You need customized, individualized, a specific type of cleanse and detoxification of your body to get rid of inflammation and toxins. That by itself could make you lose a lot of weight. As I said, fix the body, you will lose the weight. Fix the organs, you will lose the weight. That's what needs to be done.
I was feeling tired, I was, lack of focus, I just wasn't energized at all. But with the treatment that I've been getting, with, all together, collectively, I've just been feeling a whole lot better.
If you don't fix the body, you are not going to lose the weight. If you have done cleanse and detox that took less than 30 days, it will not work effectively. If you have done detox and cleanse and had food elimination or juicing or restrictions, it will not work because you're going to go back to uncleansing. You're going to go back to your routine diet. We have had many patients just by being on our cleanse, they have lost weight. I want you to understand something. The medical model is very, very deceptive, misleading, Pharmaceutical companies, they're running our medical society, medical community. Pharmaceutical companies are telling us what's good, what's not good. If you have high cholesterol, it's bad, take pills for the rest of your life. That gives you neuropathy. That gives you heart problems. Again, I'm not telling you to take or not take any medication. That's the job of your prescribing doctor. We need to give you drug-free, non-synthetic, organic, pharmaceutical grade natural supplements that will help eliminating toxins and inflammations in your body. That has worked successfully on hundreds of our patients. That includes the doctors who come to our office as patients. Some of the supplements that you're going to be getting, they're going to be in liquid format. Some of them are going to be in pill format. Some of them are going to be in creams format that you put on the body topically. Why? Because some of them work better as liquid, some of them work better as pills, some of them work better as topical creams to bypass the gastrointestinal tract that is full of inflammation. The reason I say that is I want you to understand when you come to my office, if you come to my office, I don't want you to argue with me. I don't like powder, I don't like liquid, I don't like this, I don't like pills, I don't like creams. This is the matter of life or gradual death. I'm very serious about fixing your body.
Hi, I'm Passaic County Sheriff Richard Burdnick, and I encourage everyone to come to MedWell. The treatment here is fantastic, the staff is wonderful, and if you want to get better, this is the place to be.